question, when's the last time you heard of someone suffering from gout? Well, it turns out it's not just your great-grandparents' disease anymore. Dr. Elliot Rosenstein joins us today. He's director of the Institute for Rheumatic Autoimmune Diseases at Overlook Medical Center, where gout is still kicking. Let's talk about what it is. I don't think most people really know what gout is.
Well, gout is a type of arthritis. It's unique. It's a metabolic problem. It happens because of accumulation of uric acid, which is a breakdown product of the DNA, excuse me, and the other nuclear material that we have in our cells. And it can accumulate in the joints. And it's famous for causing a very viciously inflammatory type of arthritis.
And then what's the outgrowth of that? Is it a problem walking or problems in joints, or what's the outgrowth?
Well, it can cause acute pain, typically in the feet. So the big toe is classically the joint that gets most affected. Mm-hmm. And when we think about gout, we usually think about middle-aged men who get this condition, but it's not just middle-aged men. Mm-hmm. There are different situations where gout can develop. So the historical image that many of us have is the older, fat, rich mm-hmm. man who's been overindulging in food and drink and develops gout. But as you said, it's not just your grandmother's gout, it's not just your grandfather's gout. It can affect men and women. It can affect young and old.
Wow. And you're right, we usually think of it being the result of living the excesses of the good life.
And that comes into play. It's certainly related to diet. If we overindulge in certain foods, that may increase the risk of developing gout.
Foods like?
Foods that are high in animal protein. Alcoholic beverages, in particular hard liquor and beer, not so much wine, which is something that was really newly elucidated.
Really?
Soft drinks that are high in high fructose corn syrup.
Mm-hmm. Sugary stuff that our New York governor is trying to get rid of?
Exactly. Not diet soda so much, but the real stuff. Mm-hmm. And they're interesting. Lately, we've discovered that certain foods may be protective. So dairy products don't cause gout to the same extent that meat and fish do, even though the protein content may be very similar.
Interesting. Interesting you mentioned fish, because we usually make a distinction that the meat is bad and the fish is good, and that's not necessarily the case.
Well, fish is good in certain respects, but when it comes to development of gout, they're both pretty offensive.
Mm-hmm. You say that it goes across the board. Who's more likely to develop this?
Well, there are basically three situations. The first one we talked about, the middle-aged man who's overindulging. We also see it in older women, typically women who are taking diuretics for high blood pressure, and they develop it in unusual locations. The middle-aged man in the foot, the older woman more often in the hand, particularly in women who already have some osteoarthritis in the hands. Mm. And what we're seeing more and more is renal transplant patients or people who have had other organ transplants because of the loss of kidney function and because of some of the medications that they take. We're seeing gout develop in those people too.
Now, are there preventive measures you can take, or foods that maybe stop the progress or slow the progress of this?
Well, when it comes to foods, it's mainly avoiding the foods that are likely to aggravate it. Mm-hmm. In terms of foods that are likely to help, there's no great evidence. There's talk of cherry and cherry juice being helpful, but for the most part, it should be avoidance of the foods that we know can aggravate it. But there are tremendous medications to treat the condition. Mm-hmm. And we can treat the inflammation with certain medications, and we can treat the underlying metabolic problem with other medications.
Mm-hmm. How does this present itself? I mean, at some point you know you've got a problem. Is it a swelling somewhere or a pain somewhere?
Well, it's usually acutely painful. It comes on over the course of 12 to 24 hours, and it's often spoken of as one of the worst pains that a person can experience. Mm-hmm. And the typical acute presentation is in the large toe or in the ankle. It's usually a single joint. And it goes away over the matter of days to weeks, but then it comes back. Most people will experience recurrent pain. And as time goes on, it becomes more frequent, and the episodes last longer.
So it's going to make you go to the doctor.
It's going to make you go to the doctor, and hopefully the doctor will make a definitive diagnosis by examining the inflammatory fluid in the joint, because that's really how you determine if somebody has gout.
Does it mimic other things, or?
There are other conditions that can behave a lot like gout, and unfortunately there are people who have had their toes removed because of gout when it was confused for an infection that wasn't responding to antibiotics.
That's pretty extreme.
It is extreme, and it's unfortunate because the diagnosis is fairly easy to make, and it's one of the more treatable conditions we have. It's actually curable with the right medications.
So curable and avoidable given the right diet?
Correct.
Okay.
That diet doesn't always protect, but diet can certainly influence it.
And hereditary?
There are predispositions. There are some genetic abnormalities that make gout develop in very young individuals.
All right, well, good stuff to know. I'm assuming that you've got more studies on this ongoing as we speak.
It's very active. There's several new medications that have come out in the last few years.
All right, we'll keep our eye on it. Thanks for coming to share with us, and I will look to have you back on other medical issues.
Sounds good.
Thanks, Doc.